Well, I think it's primarily because a lot of primary care providers have just not been trained to either detect, identify sleep impairment. And typically in medicine, when you screen or assess for something, you must then treat it. But I think too, outside of the clinical kind of operational factors, I think it's culturally as well. I think our culture doesn't necessarily see the value in sleep and see the value of sleep as a bona fide medical program. And I think that is kind of, saying the quiet part out loud that not many people want to hear. And so many people think that sleep is antithetical to productivity. And then the third part is more so around insurance coverage, that if sleep were better covered under primary care as well as specialized care, then you'll find a lot more people actually screening for it as well. So one is the training and education of clinicians and providers where they don't know how to screen for it, and we don't have reliable quick assessment tools for sleep and then what to do with it. I think there's a cultural component, and then there's also a compliance part with regards to insurance, that if these were better reimbursed, then it would be more likely to be part of work streams. So I think generally, for example, and even if they don't complain, but if say for example, someone complains about being fatigued constantly, even when they say that they are getting a sufficient or adequate amount of sleep, that is usually, a red flag. But also clinically as well, a lot of the work that I do, focuses on cardiovascular disease. And we oftentimes see this, that individuals who may have resistant hypertension, and that is when individuals who may need to try different classes of antihypertensive medication, when none of them seem to be actually effectively lowering blood pressure, it's very likely that there is a underroot or kind of a root cause of that. And sleep generally is maybe undetected, undiagnosed, untreated sleep apnea, and even in insomnia as well. And I think those are two kind of clear red flags when, from a patient reported outcomes and quality of life issue. And then clinically, if you're trying to treat a particular condition like hypertension and it is somewhat recalcitrant to treatments, then it's likely that there's some undetected, undiagnosed, and untreated sleep apnea or sleep disorder issue going on. I think, I've oftentimes said that sleep is an omniphenomenon, and here's what I mean by that. So sleep can act as a correlate, it can act as a risk factor, it can, serve as a causal factor, or it could just be, a consequence or an artifact. Let me lay those out. In terms of a correlate, essentially what that would look like is if someone, there's just the presence of poor sleep with a particular condition. And then the primary concern is, obviously treating the person with hypertension or diabetes. But the sleep may play a critical role, not just in terms of the clinical outcomes, but let's say that individual is really suffering from a quality of life standpoint. If that person is suffering from a quality of life standpoint, that can significantly impact adherence to medications and treatments. So while as a correlate, it doesn't necessarily, impact outcomes, clinical outcomes, but it particularly serves as a critical facilitator in improvement of and leading healthy lifestyles in order for that person to get that clinical outcome, positive. If you're looking at more at as a risk factor and a predictor, there have been many studies, both meta-analyses, which is kind of the holy grail that looks at a pool of different, clinical trials that have shown that sleep, particularly, poor sleep, so getting less than 7 hours per day, can significantly increase someone's risk for cardiovascular disease as well as diabetes. And then other studies have shown that when people are treated with the necessary treatments like positive airway pressure for sleep apnea, that when you have this controlled type of adherence and you're monitoring that, you can see improvements in blood pressure. By that, you will see reductions of blood pressure, and then you can see more normalized glucose levels and reductions in insulin sensitivity, insulin resistance. So those are some clear examples, both from the body of literature that shows that sleep really acts as that omniphenomenon, whether in terms of a correlate or a driver or even a consequence as well, where you see the improvements of sleep and it improves those clinical health outcomes as well. So we're actually trying to do that right now. There have been so many different studies that have tried to do that. But I think, what we need to do as a field is to incorporate more clinical decision support. And how we're going about that is we're saying, let's take a lot of the heavy lift out of the hands of providers, where a patient who might be in the waiting room, they can fill out a quick 2 to 3 minute survey that can show us whether or not if sleep is an issue for this particular individual. Based on that, what we try to do then is to create a decision rule to say, well, if this person reported or endorsed sleep impairment, then the goal then is to have the primary care provider or someone part of the treatment team to do a little bit more interrogation based on that screener. And from there, you can use other forms of clinical decision support to then find ways in which you can triage that person. Maybe that person needs to be seen by a specialist, and it could be a behavioral sleep specialist, or it could be a sleep medicine doc. And so those are some of the areas that we're really focused on. But you can even take it further. One of the things that we're very happy to do, that we have done, and we've been leaders in this space, we have incorporated digital solutions to be able to help with the triaging and screening of sleep issues and sleep disorders. We created our own sleep, based remote health monitoring solution where you send to people's home. You can monitor them over a 7-day period. That's more passive type of assessment, where it doesn't take a lot of effort and time from a treatment team. You ship it to people's homes, and that gives a pretty good, profile of someone's sleep. And based on there, you can then triage and determine if the person has a significant sleep disorder. And then you can maybe take them to a sleep clinic, or you can do a home sleep assessment test to then give that person a more streamlined, frictionless experience with a sleep medicine specialist. And from there, we can determine what interventions work for whom. And I think this is where the value of using technology and AI comes in, where we can start to do some very unique phenotyping of individuals to determine what they're at risk for, and then to look at what their risk, and then determine the types of treatments, and then monitor them over a period of time and give them the best intervention that is bespoke and tailored to their particular condition and their context as well. We've seen significant benefits, right? So for example, what we do find is that particularly in middle-aged individuals where they might be experiencing significant changes in health and their health profile. This is generally when you see a lot of chronic health conditions surface. If you can actually intervene on that person's sleep health and improve their sleep health, it is very likely that you can actually stave off or arrest or better manage that trajectory of that other chronic health condition, like a diabetes, like a hypertension. And so there's been significant evidence that shows that. And so early detection can lead to better prognosis, and then therefore can lead to better health outcomes and quality of life that could potentially stave off, arrest, or actually completely eliminate the trajectory toward chronic health conditions. And not just that chronic health condition, but one of the things that we've seen in the literature is that poor sleep is linked with obesity and other cardiometabolic health conditions. And that particular cardiometabolic risk really serves as that linchpin that opens up so many other different chronic health conditions, from cancer to stroke, to hypertension, to heart disease, to autoimmune diseases. And so if you can solve this connection between sleep and cardiometabolic health, particularly through the pathway of obesity or being overweight, that can then potentially prevent a whole host of different chronic health conditions for individuals.